most important. This decides the health of the population, not the person sitting at the ivory tower who only give the guideline principles, give the guidelines how to give the thrombolysis, but ultimately it is the soldier who decides the freedom and the boundary of the nations. And therefore, the peripheral doctors must be proper. Health by definition, however, one thing is certain, that health system is not proper all over the world. This is the global analysis of various surveys that still health system is not good. Why it is not good? This is because of various changes. These changes are occurring, and the legal changes which are occurring are more than anything else. Everybody nowadays is fearful, but understand why legal changes, why astringent many laws have come in the practice. That is because of, it's not a drop in ocean which is infected, it is the mass, and that it is more than 50%, then only something becomes significant and sensitive, and that is the cause. There is a explosive revolution of medical knowledge also. This is a white coat ceremony going on. Number of doctors per year are 10 times more than 1 decade back. Still the medical care or the health is not up to the mark. Why this is occurring? This subject needs intuition and inner thinking, why this is occurring. Previously in Yavatmal there were only 5 doctors. Now the number is 151. But still the health of the Yavatmal district is not beyond the expectation. This needs, this is a quantity which is increasing, qualitative increment is also needed. Super specialization is a need of the time. And however, one has to remember that it is the baseline of the triangle or the pyramid must be broad, and this is to be maintained. The information is going on. Many patients come to us and say, doctor, why you have not started this drug? Internet says that that is the drug of choice. So therefore, we must have, there is a cartoon that the patient knows more about their disease than me. I must get faster to modem, high-speed internet, and access them earlier, otherwise I will lag behind. Corporate hospitals are coming up. It is need of the time. However, the depersonalization of the patient, it is nobody's baby. That is the main disadvantage. That needs to be protected. However, there are good advantages of the corporate hospital. One personal comment is the medical subject has been taken over by the persons who are not medicos. Corporate hospitals are owned by those persons who are not medicos, and that is the painful fact. Capitalism, as म्हणतात की there are 3 worst things which has happened in last 100 years, that there is a terrorism which is increasing, the capitalism which is increasing, and poverty which is increasing. And this is the root cause of why health is not properly coming up. A recent survey shows that there is a direct correlation between life expectancy and payment of medical bills. Corporate benefits to the corporate hospital owners is like this, and where my poor doctor is. And therefore, this is a good thing that every district, doctors should come together. I am one of the activists of many associations. Doctors should come together and form the corporate hospital rather than external persons, because they have got various kind of resources they should. Here, it is very clearly shown that only placebo treatment is available because of the capitalism which is going on. Medical insurance is a good boon, use it properly. However, you can stop now my stress test. The result shows your insurance doesn't cover this test of this type of result, and you please stop. That is how the insurance. Our profession is no more our own profession, mind well. Now everybody and anybody is doctor. Dietitian is also wearing white apron, and he is or she is also doctor. Likewise, our profession is, at one time we were only talking on the stage. Now non-medicos, non-MBBS, non-MD, non-graduate, postgraduates are also behaving like a doctor, and this is a great change which has percolated, divided the creditability of our profession. One important change is the patient and physician distance is increasing, and this needs to be taken very carefully. There are many parameters by which the correlation between doctor and patient is operating. Traditional model which is shown on right side, that patient is bowing himself and saluting to the doctor, is no more true. and the right-sided one is the patient is sitting and doctor is standing and asking the history. This is common phenomena now. One of my students practicing in UK, gynecology, he told me that my patient told that I want the second stage of labor in tank. Second stage of labor, I want in a, not in the hospital. I must be submerged in the water. And we 10 doctors were just standing. That is how the services have gone. That where is the dignity of doctor? The same thing is going to happen here also. Ultimately, we take history, we do the physical examination, we do the investigation, and we do the follow-up also and come to some clinical diagnosis. Good outcome occurs, everything is good. But when bad outcome occurs, the things are taken in a very bad way. There are two ways of bad outcome. One is desirable bad outcome and another is undesirable bad outcome. Desirable means you say or we communicate to the patient, illness 70 वर्षाचे बाबा आहेत, hemiplegia आहे, intracerebral bleed आहे, brain edema आहे, midline shift आहे, things are going to happen like that. We are trying a lot. Patient's relatives are satisfied. We are also satisfied. He is going downhill, multi-organ failure, ventilator 5 days, ventilated associated pneumonia has also occurred. The things are going down, saturation is down, everything is explained daily to the patient. On 10th day, patient dies. Okay. So this is a acceptable, desirable bad outcome. But you told to on day 3, okay, now there is no danger. 99% is out of danger. Tomorrow we are planning to ship patient to the ward and in the midnight patient dies. That is undesirable outcome by the relative and you also. So therefore, these undesirable outcomes are to be avoided. And how to avoid that? We should be very clear about anybody in ICU, anybody sick. I recollect one patient who was to be discharged, that was day 10, and she told that today I am not going, Dr. Sahib, आज अमावस्या है, आम्ही जात नाही. And midnight she had again second myocardial infarction and she died. Daily she used to tell me, मला ते बोलवता आहेत, मी जाणार आहे, तू कितीही प्रयत्न केले तरी मी राहणार नाही. There is something like this also happens. And we cannot rely only on the science. I am not here to propagate that non-scientific fact. But the patient's positive attitude has got great value. That also need to be understood by us while communicating with the patient. Only just technocratic scientific way is not enough. And undesirable outcomes have to be managed very nicely. Whenever bad news is to be given, here, no, your news is not hard for me to swallow. Doctor, it just takes time to swallow. And therefore, you please give bad news in a good way. Wrap in a proper, even bitter things are to be so. 5 दिवसापासून तुम्ही बघताय वातावरण किती एव्हरीबडी आपल्यातले सर्वेच्या सर्वे तुम्ही पण 1 डझन नातेवाईक इथंच राहता आम्ही पण प्रयत्न करतोय रात्रंदिवस प्रयत्न सुरू आहेत पण मला तर काय आशा वाटत नाही 100% अंधार आहे अंधारात उजेड पडेल असं वाटत नाही प्रयत्न आपले सुरू लाइकवाइज you prepare the mind if cerebral cortex action potential has dampened down to the tune of a flat level before it requires flat level then there is always a acceptable undesirable outcome and therefore it requires time in addition to the medical care to give the this is the short list of my main symptoms in the last week likewise the patient go on telling but there is a one international study if below 40 somebody is giving more than 40 complaints he is organic patient and after 40 if somebody giving more than 40 organic symptoms he is non-organic patient. It has got double-blind control trial on this. It is not a non-specific finding. Many times we understand this patient is very difficult patient. 5 दिवस झाले डॉक्टर अजून ताप उतरत नाही तुम्हाला तापला स्वभाव माहिती आहे हँड keeping my hand in his hand and telling me like this. I know he is a bad people. They are with me and they are to be managed. But however, the difficult patient is defined as a person to whom you don't like or he also don't like you. In bilateral way, they are the persons who are real credit to you. It is not the simple angioplasty which is creditable. Bifurcation, triple vessel, 3 blocks at a time, hypotension, still managing. So it is the complex scenario which makes the thing more in practice also, in patient care also. It is the difficult patient which are more creditable. Otherwise, WBC is not good. Well, baby clinic, everything is okay. That should not be done. Patient we don't like, and the patients to whom we are also not like. Calmness is the central theme of a good medical services. You must be calm and quiet. There is no way out. We have to remain. This type of a mental distortion goes on occurring, cat and rat phenomena, if we are not following this. If we don't know our limit of working, then cat and rat occurs in the brain of patient as well as doctor. If we are not going to reinforce our knowledge, if we will not compromise, जोडतोड तोडजोड मोडतोड केल्याशिवाय mid path regimen is called as the best regimen anywhere, whether to do surgery or medicine. Mid path, when needed get the surgery done, when not needed be on medicine. Likewise we have to do the same phenomena. So therefore please find your vision and have a freedom from your selected work also. You have to have the power to choose your work. If somebody, if you don't have power, then you must follow your own natural law and ultimately the capability and ability of every individual. Many times nowadays patients are telling, if you want, doctor is telling to the patient, if you want, I will give you second opinion, I can ask to the computer. There is a diagnostic revolution also, but please utilize the things which are useful. Otherwise, every jaundice patient is subjected to the viral load studies, spending 10,000 rupees. My poor patient is, so therefore, the diagnostic revolution is okay, accept it, do it when it is needed, not to do when it is not needed. However, it is needed when it is having a therapeutic benefit. My chronic myeloid leukemia patient is living for 10 years. It is curable now. So in that situation, I will go on investigating more and more. The diagnostic, many modalities are available. They are a double-edged weapon. And this is one thing why CPA has come. Why many laws are come? Because patients have to spend more on the cure rather than the investigation. There is the high-tech medicine has gone to the tune that this is one of the slide that baby sitting in utero. She is given eviction notice, still baby is not coming out, and baby is communicating to the mother, it is my right to stay here till I want. Likewise is the high-tech medicine going on. We have to, when we take the cold drink, we let the froth settle down and then take the drink. Don't take the froth. Likewise, let everything have an acceptable level of positivity and then to do that investigation. All investigations are quantitative investigations and they fall in this particular curve which has got its own limitation. 5% are outside this curve and pseudo-positive and pseudo-negative. Therapeutic revolution, every therapy which is new may not be good. Let it have a universal acceptance. RCT is the best guideline. Randomized controlled double-blind trials, what they advise, that is the really acceptable thing. Medical knowledge is increasing so much that every 5 years, 50% medical knowledge is outdated. Unfortunately, we don't know which will be outdated. So therefore, we have to know everything at any given time. ICCU is one place where patients get lost, and therefore we have to take extra care, particularly here. Therefore, ICCU syndrome is common in 25% of the population, where they become dementia, delirium, and so on. So, in this fast world of changing medicine, there can be problem of diagnosis. No, it is never a problem. We are sufficient brilliant. There can be problem of implementation of therapy. No, we get the newer medicine so fast. There is always problem of third type, that is doctor-patient relationship. And this needs this trust principle to be followed. Trust means therapeutic relation. TR means maintain therapeutic relation with the patient. US means have uncertainty to be shared with the patient. When something is uncertain, you share with the patient in an equal proportion. Patients are keeping, they are in a REM sleep and you are worried about the Ventac. That should not happen. You disturb their sleep also. Both should have a parallel wavelength of the stress. That is what the uncertainty is to be shared, and truth. Nowhere the truth is more important than medical practice. Truth is God and God is truth. That is what Mahatma Gandhi's mission was throughout the life. This is another problem, newer changes. Bogus doctors are increasing. They are our competitors. They are our guidance. They are our philosophers. They are our feeders. Therefore, we inhibit our nails and teeth and so on. Medical ethics is one thing. When you diagnose something, that is what my patient has got is the diagnosis. What my patient should be treated by, that is therapeutic. What I should do is the ethics. Should comes, that is ethics. Nothing else. Ethics is not a very complicated phenomena, and should is characterized by autonomy of the patient. Patient has got right. You cannot tie the hands and leg and you must remain here. Even if in emergency, we have to maintain his dignity by his autonomous. There are some exceptions. He should be beneficial person all the times to come, and these are the guidelines. But Gandhian philosophy is one which is the best. You should not de-norm necessary. You have no right to harm anybody. And this is directly or indirectly, if it is done and if it is understood and if it is given a proper shape, then we have it. Ethics is not like this. They are copying each other and taking out the notes on ethics. Ethics is a behavior which we should have. Advice and autonomy to be compromised. This is another area where there is a problem. Alternative medicine. But we cannot, alternative medicine is a medicine which is without any scientific evidence, but however there is a social evidence, small subject satisfied, subjectively propagating in the society about the pathy in question to the tune that listener gets accepted, it is better than CABG and PTCA, and they go on going there, and we are told that no, Dr. Sahib, तुम्हाला जमलं नाही बरं का ते. हे मागच्या महिन्यात तुम्ही सांगितलं तसं नाही ते. Likewise is the things which are happening. But however, this is the comment by experts in medicine. I have no objection to alternative medicine so long as traditional medical fees are scrupulously maintained. That is what the approach of most of the polypharmacy is one area which is very, the longer and longer prescriptions pads length and breadth is increasing. We prescribe more than 12 and 20 drugs. That is not good. Even in CRF, which is the one condition where maximum number of drugs are required, they should not exceed 12. But on an average, every prescription should be below 6 drugs. More than 6 drugs, it causes complication. Drug reactions are very, very common. To the tune that International Mortality Morbidity Survey says that in addition to the cerebrovascular episode, coronary artery disease, carcinomas, the accidents, AIDS, anaphylaxis is one of the most, 20% of the patients are dying because of drugs, directly, indirectly, immediately or latent. But the polypharmacy needs, however, in spite of so many bad things, there is a good news also. Smallpox is dead. This is a great achievement. But last 100 years of survey was done. What is the output of this revolution, scientific revolution? And the summary prepared by the Oxford textbook of medicine says that these are the 3 inventions and discoveries which are really helpful to the human being. One is the gene. And within 5-10 years, every one of us and our patient will have a card in our pocket containing our genome, which will be first subjected and given to the doctor. He will first download that, then think about, then take the history, then ask us what is what. So the genome project has given a good way, and this is a great recovery invention, and it is going to help human being a lot. Second discovery and invention is ORS powder, very important. It has saved millions of small babies from dehydration and hyponatremia and lifestyle modification. And this third I wanted to highlight, which is not properly advised by us to the, there are many challenges in newer inventions. So ultimately we come to the conclusion of the talk that science and technological revolution has got positive QRS. It's definitely helping us. And you have to, I have to, we have to accept that science is really science. And it is for benefit of human being. How we utilize is, that is the another side of the coin. Law, 50% laws are good, 50% laws are bad. They have come into existence because of ultimately like a typical scene or a scenario created by our people only. And third, which is like a negative Q wave, that is the attitude of doctor, altitude of the patient, interpersonal relationship and intraperson relationship, all human beings are changing towards negative direction. This requires change, and that change is possible by if we understand the philosophy of life. If you want happiness, what is after all happiness? Happiness is a inner feeling subjectively perceived by an individual for a purpose, for a prejudiced mind, for purposefully feeling that I am happy. Otherwise, nobody is happy. Happiness is never without, it is within. And likewise, if one wants happiness for 1 hour, go to sleep. 1 hour will be enjoyed. If you want happiness for 1 day, go for the picnic. If you want happiness for 1 week, go to the voyage or long trip. If you want happiness for 1 month, that is only 1 month, half-life of 1 month. If you want happiness for 1 month, get married. And if you want happiness for 1 decade, become a rich. But it is only 1 decade, not more than that. If you know the Bill Gates story, that he has dedicated all his money to the WHO and all other the NGOs. And he is working as a secretary of his association, taking only payment of few dollars. And he says that money has never given one of the richest man's thought and action is like this. So, but if you want happiness throughout the life, love your work. Many times I come across my physician friend, फार चुकलं हो, डॉक्टरनी व्हायला पाहिजे होतं, डॉक्टर झाल्यामुळे फार चुकलं, काही मजा नाही आली, इंजिनियर झालोस तर माझा तो मित्र आहे फॉरेन लाईकवाईज. However, the take-home message is, it has been found that doctor's life by becoming doctor is reduced by 6.5 years than the average population in society all over the world because of a stress, strain, and work which you are doing. This is more so by 10 years minus in anesthetist, in ICU intensivist, and third is the psychiatrist. These three populations have got minus 10 average lifespan by their. So therefore, we should take care of ourselves also, and the welfare of you is in this. Everybody talks of what is the lifestyle change, but what exactly lifestyle change is shown in this diagram. This ABCD is a take-home message. A means aerobic exercise. Everybody has to do aerobic exercise, minimum 35 minutes a day, 150 minutes a week. You should perspire, you should have a palpitation, you should have a puffing, and the inner garment should be. Likewise, the exercise should be done. That is what called as a, you reach your target heart rate and then only it is useful. Do this and ask your patient to do that. All chronic, non-infectious, non-communicable diseases will reduce a lot. More effective than thrombolytic therapy. B is BMI. Our BMI has to be below 25, and we doctors should follow this. C means cut down the salt, irrespective of one is hypertensive or not. Dash diet means half of the plate should be filled with the vegetables. 3 teens of these vegetables and nuts. 2 or 2.5 rotis, no salt, no, likewise no sweet dish, no rice. This is what is needed nowadays. One should go in details of what dash diet is and eliminate sad things. Sad means smoking, alcohol, and drugs. So this is what the conscious of medical fraternity is to be increased to the tune that these things are possible. This is what our picture should be. Doctor is standing like what is shown in this, and the patient should be gratified like this. Otherwise, if this is achieved, we have achieved what we are. This is the question which is commonly asked. Who is the most difficult to find in India? The BBB is asking, Big B is asking the 1 crore question to the doctor. Who is the most difficult to find in India? Incorrupt politician, government doctor in village hospital, Indian doctor without patient, and college student without cell phone. And the answer is left to you. Thank you for very patient listening.
Thank you, Dr. Patil. It was an excellent, exhaustive, informative lecture which sets in several thoughts in our mind. But I hope the situation is such that you do not generate any questions In fact, you develop that habit of inquisitiveness and introspection so that in future you remain happy and happy ever. Thank you.
I request Dr. Wagh sir and Dr. Rathod sir to felicitate Dr. Dilip Patil sir.
All deliberations are over. Thank you, API team Nagpur, for their continuous presence from 2 days. And thank you to my colleagues, particularly office bearers. Thank you, and have a lunch. Thank you.
Friends, I must express sincere appreciation for the organizing committee of Vapicon 2013, Dr. Rathod, Dr. Wagh, Dr. Agrawal, and his entire team. They deserve a huge round of applause for all the efforts they have put in and come up with something which has been unique. That has been the trademark of Vapicon since it began in the year 2009, that each and all of these conferences had their unique standout features. And we've been here for last 2 days, and we have witnessed excellent scientific contents, good hospitality, all arrangements nice and proper. And I once again express my appreciation for Vapicon, the organizing committee of Vapicon 2013, for having done an excellent job. Thank you.
तीसरा क्या